اوكي
تمام.
السلام عليكم. بسم الله الرحمن الرحيم. We are going to talk today about liver, gallbladder and biliary and pancreas. Actually, these are three important organs. It's very difficult to cover the subject with its basics, anatomy, physiology, and pathology affecting these organs, then how to treat the pathologies affecting these organs. But we are going to put some highlight points upon these organs. So, liver, gallbladder, and biliary, pancreas. Liver is the largest gland in the body, and it weighs about 1.5 kilogram. Anatomically, liver described with two anatomical lobes. The right and left lobes. Divided by the falciform ligament. This is anatomical description of the liver, but there is surgical description for the liver. This is the segmental description, divided into 1, 2, 3, 4, 4A, 4B, reaching the right side of the falciform ligament, then 5, 6, 7, and 8. This is for surgical intervention because each of these segments has its own biliary. The parenchyma of the liver, in addition to containing the liver tissue, it contains the biliary tree. And the biliary tree arising from the liver and join each other, forming the main left and right hepatic ducts. They join to form the common hepatic duct. Then this will join with the cystic duct to the gallbladder, forming the common bile duct, and the common bile duct join with the pancreatic duct to open to the ampulla of water. This ampulla controlled by special sphincter called sphincter of Oddi. So this is grossly the description of the anatomy of this area. Here is the pancreas. When you talk about the details of the anatomy of each organ, there is a lot of talk. For example, when we describe the gallbladder, it is a barrel shape, contain fundus, body, and neck. Of course, connected to the cystic duct. There is here, just like the verticulum or a pouch. Commonly you will hear about it. It is the Hartmann pouch. This is normally not present in the gallbladder. It will be present when there is a stone here causing compression and circulation عربي؟
شوية
اوكي.
دكتور طالب هسه قاعد داعس هو جاي يستوعب
يعني this is simple language يعني you can understand. Adapt yourself to learn by English language. You are going to attend conferences, seminars. يلا نطعم لكم اياه. فعلا شكل المرارة هي مثل العرموطة، تماما تشبه العرموطة. الشكل هذا. This is the details of the gallbladder, and there are details for the pancreas. The anatomy of pancreas. When you want to describe the pancreas, contain. This is a sagittal view for the pancreas. Contain also body, head, and tail. And between there is a junction, and this is the uncinate process. Here there are major vessels, the SMV, superior mesenteric vein, and SMA, superior mesenteric artery. So that's the head of the pancreas in relation to the duodenum, second part of the duodenum. You are seeing this in the picture. The pancreas contains main duct, and there is a duct of Wilson. This is an accessory duct which can open separately into the duodenum. That's simply the gross anatomy of the region, and we are going to talk about what are the importance of these organs in the digestion. So on the next slide, we are going to mention some of the functions of these organs. For example, we are going to mention the function of the liver. What do you expect? How many functions have been known till now for the liver? Can you answer?
detoxification
How many? بس عدد الطيب.
وايد
زيادة يعني.
وايد
Till now, more than 500 functions have been found for the liver. Some of these functions إذا تقدر تغير السلايد. A lot of functions till now are unknown. اكو سلايدات كبرناها تخص الاناتومي.
الاناتومي دكتور بني؟
اي تريدون نسوي لها ديسكربشن؟ لا عندكم باوربوينت او اكو سوري بوينتر.
عمو دكتور تي تأشيرة
على الماوس تأشيرة.
بلي؟ هاي شغلة لك الليزر. لا دكتور. بس دقيقة. بس دقيقة دكتور.
ارجع
تمام.
ارجع للسلايدات. ارجع. So that's the pictures for the liver. This is the left lobe, the right lobe, and here is the gallbladder attached intimately to the gallbladder. Its bed. This is the falciform ligament. This is we are seeing the liver from inferior. And these are the areas of the liver. This is the bare area which devoids peritoneum. And that's the caudate lobe. Here we are seeing the liver from anterior view. This whole is the right lobe, and this is the left lobe, and this is the coronary ligament, this is the falciform ligament. We have two triangular ligaments, the left and the right. But mainly the liver is attached to its side by small veins connected to the IVs, inferior vena cava. Although these ligaments are very important for orthotopic position of the liver, but the main handling of the liver in its position is by short veins connected to the IVs. The circulation of the liver comes from the hepatic artery, which comes from the celiac artery, celiac trunk, originated from the aorta, and from the portal vein. Portal vein gives about 80% circulation to the liver. So the main blood supply is from the portal vein. Portal veins formed by junction of the splenic vein plus superior mesenteric vein. They join together to form the portal vein, and they give 80% of the circulation to the liver, 20% only coming from the hepatic artery, but the oxygenation is 50-50. The hepatic artery gives 50% oxygenation to the liver, and the portal vein gives 50% oxygenation, but the circulation portal vein gives 80%. So regarding the function of the liver, some of the important functions of the liver is responsible for detoxification of the toxic substances.
غير سلايد سلايد غيره.
Hey, next. Detoxification. A lot of toxins come to the body, for example, from the GIT and intravenous treatment or oral treatment, some of the medications, drugs, mainly metabolized in the liver. So it is responsible for detoxification of the toxic materials from the body. It maintains the temperature. Liver is responsible for maintaining the body temperature in a fixed range, and it is responsible for also pH in the body. As you know, all the chemical equations in the body should be done within certain pH. So who is maintaining this pH? It is the liver, plus طبعا of course the kidney and lung. They are responsible for maintaining the pH, but the liver is responsible for correction of the pH in case of lactic acidosis. It is responsible for manufacturing the clotting factor. So it is the most important organ to maintain hemostasis in the body. It is responsible for synthesis of clotting factor. Some of the metabolisms of the glucose, gluconeogenesis, building of proteins, manufacturing albumin, and it is responsible for joining two ammonia particles to form urea. So if you have liver failure, the level of urea will drop down. When we talk about any affection of the liver by certain diseases, then these functions will be affected. For example, if we have chronic liver disease, then these clotting factors will be not manufactured anymore, and the patients will be liable for bleeding. The albumin and the protein also will drop down. And these functions are very important in monitoring the liver status. Actually, liver can be destructed in 80% and it keep maintaining its function. ثمانين بالمية ممكن يصير parenchymal damage of the liver and the liver still maintain its function. يعني 20% بس يبقى من الليفر parenchyma and this can maintain the function of the liver. What is the function of the biliary tree and gallbladder? Biliary tree and gallbladder, they will collect the bile from the liver biliary tree will collect the bile from the liver and then it goes to the gallbladder. So the main function of the biliary tree is collection. The main function of the gallbladder is reservoir for the bile. Here the bile is collected and it is concentrated. There will be absorption of water from the bile to be concentrated, in addition to the secretion of some mucoid material. Then this will be excreted into the duodenum, as I told you earlier. What is the function of bile? Bile is very important. Bile contains bilirubin and bile acids. Bilirubin is only waste product. Bilirubin is only waste product, and it is responsible for the color of the stool. So when there is no bilirubin, the stool will be faint in color. أو يسموه تلقين خاوة فاتحة. But the bile acids are very important in absorption of fats and fat soluble vitamins. اللي هي شنو؟ أكل.
ايدك بدي
أكل. عوف الدين لا تخلي ايدك بالدين. مو زين. So the bile acids are responsible for absorption of fat, because fat with its structure is not absorbable from the gut. The bile acids will form just like muscles from in the bowel, and this will be absorbable. And of course, this is very important, the absorption of vitamin A, K, E, and D. Vitamin K play a very important role in the clotting system. So there are vitamin K dependent factors اللي هي 1952. تاخذون كل هيموستاسيس ان شاء الله بعدين تفهمون بانهم اكو factors depends on vitamin K. So we are calling them vitamin K dependent factors. So when there is obstruction in this area, the biliary tree, anywhere, preventing bile from coming to the bowel, these vitamins will be malabsorbed or non-absorbed, and this also will affect hemostasis. This point can be applied clinically because when you have obstruction here, the patient is liable for bleeding, and we should supply him with parenteral vitamin K. واحد من زملائكم سألني شنو أهمية البيزك ساينسز، بيزك نولج، ليش احنا نتطرق لها؟ ليش منعوفة يعني سنينها ندرسها وننجح من عندها وروح للكلينيكال. I told them it's very important to know the scenario of the disease, scenario of the pathology, and then to put the plan to treat the patient. And if we cannot understand the disease from its basics, then we are not able to treat. Of course, when there is obstruction also, this will cause elevation of the bilirubin inside the body. Bilirubin is of two types. It is either conjugated or unconjugated. When there is obstruction to the biliary tree, which part of the bilirubin will be elevated? More is conjugated, or we call it direct bilirubin. Hemolysis, liver parenchyma damage راح يسوي لنا elevation of other parts. مثلا بالهيموليسيس راح يرتفع unconjugated. بالبرانكايما liver disease راح ترتفع شنو؟ both of them. So these simple ideas can make it possible for us to understand the diseases. What is the function of the pancreas? Pancreas. What is the function of pancreas? The meaning of pancreas, it means whole flesh. Whole flesh. That's the meaning of the Greek word pancreas. Pan is whole, pancreas flesh. So it's whole flesh. Pancreas is very important organ with two main functions. It has exocrine and endocrine function. Okay? Exocrine comes to the bowel through the pancreatic duct and then controlled by ampulla of water to be excreted inside the duodenum. And this contains lipase, amylase, protease. كل اسم يدل على الفانكشن مالته. Amylase is for digestion of polysaccharides. Lipase is for digestion of lipids, and protease for digestion of proteins. And these are very important in digestion. Now the endocrine part, there are beta cells, alpha cells. Beta cells are responsible for insulin. And you know the importance of insulin in the body. It's very important in glucose metabolism, burning the glucose, putting it inside the cells. While alpha is responsible for glucagon and the glucagon is in contrary to insulin. Insulin decreases the glucose in the circulation, while glucagon increase the level of glucose inside the circulation. There are other endocrine secretions like somatostatin, is also secreted from the pancreas. These hormones respond to digestive products coming inside the bowel, and it is respond to hormonal stimulation inside the body and the neuronal stimulation. Neuronal stimulation. This is simply about the function of these three organs. Although the PowerPoint is dividing the subject into liver, gallbladder, pancreas, and mentioning the function and anatomy of all of these independently, I am putting all the things together in order to have the idea about this subject. هسه ننتقل إلى سلايدات أخرى. Next. Now we are talking about the diseases affecting these organs. For example, liver. When we talk about disease affecting liver, we cannot separate these diseases from disease affecting the biliary tree and the gallbladder. Liver can be affected by congenital anomalies. It can be affected by inflammatory processes, all its type, including autoimmune. It can be affected by infections. It can be affected by tumors. And it can be affected by trauma. But these main etiologies can affect any organ in the body, including the liver. For example, inside the liver, we can have what we call K.U.C.O.M disease. This is congenital. This is an example. Here there is biliary circulation and dilatation inside the liver. We call it K.U.C.O.M disease. And this will lead to multiple infections and sepsis, lead to chronic pain, and it might end with cirrhosis. It can be affected by congenital enzymatic defect or metabolic defect, like Wilson's disease. Here, there will be too much copper deposition inside the liver, which can lead to liver failure or liver cirrhosis. Inflammatory process, for example, autoimmune, hepatitis, autoimmune hepatitis. Sometimes liver is affected by toxic materials. For example, drugs like paracetamol. Of course, very high dose of paracetamol can insult liver. Another toxins, for example, from the fungal products, for example, mushroom, can also lead to liver insult and liver affection. Infections, always we divide the infections into biogenic, or bacterial, viral, and parasitic. Okay. Biogenic or bacterial, liver affection by streptococci, by E. coli, which can lead to liver abscesses. Most of these biogenic infections ascending from the biliary tree. Viral infection, A, B, C, non-B, non-C. A lot of viruses can affect the liver. And the course of these viruses differs according to the type. أي واحدة نحطها حتى نخلص.
يلا.
So, for example, hepatitis A. Hepatitis A is a self-limiting disease. It's acute hepatitis and it's self-limiting. There is no need for specific treatment. Most of the patients, almost all the patients will recover without any sequelae. But viral B infection of the liver is a chronic liver disease. And here there is sequelae. When the disease progresses, it might lead to liver cirrhosis. Liver cirrhosis. C, the same. Also, it is chronic hepatitis, and it can lead to cirrhosis. And these are very infectious, highly infectious diseases. A, orofecal routes. Hepatitis A is through orofecal routes, comes from the mouth, while B and C, it is from the blood transmission or through the circulation. This viral infection occurs mostly in patients who are using drugs, addicts people, or patients who are using tattoo and the old fashioned كانوا يستخدمون نفس النيدل ويسوون تاتو بيها. هسه يمكن تطورت الامور، كانوا يسوون تاتو بالليزر وما اعرف ايش. C is also coming from the circulation to the liver. It is very common in Egypt and also common here in Iraq. Other infection is parasitic infection. For example, amoebiasis by Entamoeba histolytica, and most important is hydatid cysts in Iraq. This is endemic disease in our country, and there is a slide showing you the life cycle of the hydatid, how it reaches the body. Human being is affected by hydatid cyst through different routes. For example,
السيستم يشتغل على البواسة. السيستم يشتغل على البواسة.
قال واحدة من ال ways of detection of the disease is immunological. So hydatid cyst can reach to the body either from the contaminated vegetables or through the contact with the animals. Contact with the animals. Sometimes it comes from the soil. Soil contains the larva, can affect the human being. And in rare occasions, it comes from blood transfusion or through the placenta from a pregnant, infected mother. Of course, we are giving examples. We are not giving all the details of the pathologies that affect the liver or the gallbladder or the pancreas. We are giving examples. Tumors in the liver, either it is primary or it is secondary. Secondary means metastasis coming to the liver. And the liver is the most common site for metastasis. Liver is the most common site for metastasis. A lot of metastasis come to the liver, for example, from prostate, from the bowel, mainly from the colon. All over the body it comes to the liver, and liver can be studied with metastasis not from its parenchyma. Primary liver tumors either is benign, for example, hemangioma, hepatoma, or malignant. For example, hepatocellular carcinoma. There are also malignancies in the liver, primarily from the biliary tree. Cholangiocarcinoma can affect the liver. Trauma, liver is liable to be traumatized in RTA, in missile injuries, and very commonly we found in RTA patients road traffic accident, حوادث السير. Very commonly you find parenchymal damage in the liver from trauma. But liver مثل ما تعرفون هو يتحمل كل شيء هواي، يتحمل toxic materials، ما أخذ responsibility كلش عالية بال pH بالهيموستاسيس فهو الأورجانز اللي can be salvaged. You can save it when it is exposed to trauma. You can repair it, you can suture it, you can resect part of it, you can resect all the right lobe, and the remaining small left lobe can maintain the function of the liver. You can donate from your liver. You can give anybody your left lobe, and you will be not affected. So it's very sound organ, حباب كلش حباب. Now these are the diseases that affect the liver. زين ما احنا ناخذ
ثلث ساعة.
ثلث ساعة. How we discover these diseases? There are signs and symptoms. and there are investigations. Signs and symptoms. Signs, what you see. Symptoms, what the patients tell you about. The patients complain. So when the liver is affected, especially when the function of the liver is impaired, then there are signs and symptoms. One of these signs is jaundice. Jaundice. Jaundice, by definition, it means yellowish discoloration of the skin, sclera, and mucous membrane. When it happens when the bilirubin is elevated. And as I told you, bilirubin is either direct or indirect. So there is normal level in the bilirubin, the blood of bilirubin. It reaches up to 1.2, and it is of two compartments, the direct and the indirect. This is direct and this is the indirect.
Conjugated or not?
Conjugated and conjugated. So when it is above 1.2 or 1.2 and above, then this is jaundice. Clinically, you will not see jaundice unless it is above 2. So between 1.2 ila 2, this is subclinical jaundice. Only by biochemical test. The patients, depends on the type of jaundice, can notice that there is yellowish discoloration in his sclera, mainly. Why sclera? Because it is whitish. So the discoloration will be obviously seen, or he can see changes in the color of his urine. The urine become tea color, or he see changes in the stool. The stool becomes faint in color, or the patients notice there is lethargy in his body.
اليوم فقط في حالة الليفر فيلير. في حالة الليفر فيلير.
لا مثلا لا مو بالليفر، مو شرط بالليفر فيلر. اكو مراحل ماكو ليفر فيلر، بس there are signs and symptoms of liver affection. For example, patients عنده يصير عنده G6PD deficiency واكل باقله صار عنده hemolysis. والliver is not able to excrete all the bile. Some of the bile وين راح يروح؟ سوري باليورين، وين راح يروح؟ باليورين. فانت مو شرط انه واصل مرحله ليفر فيلر. اوكي؟
لكن بالليفر ديزيز
اكو امبيرمنت بالليفر فانكشن تطلع هاي او هي ديجري. كل ما تكون الامبيرمنت عاليه كل ما البيليروبين يصعد. As an example. For example, viral infection. Some of the patients with hepatitis A, they are not noticing that there is jaundice. While others, they notice that there is jaundice وباليروبين ممكن يصعد 10. هو إذا تعتمد على degree of impairment, severity of the disease. أكو قسم hepatitis B بس ما عنده هو jaundice. ما عنده jaundice. But it depends on the degree of infection and the progress of the disease. السيمتومز اللي يشكون عند المريض مثلا lethargy قلنا. lethargy, loss of energy. patients تشوفه تعبان، tired, fatigue، ما يقدر يقوم، ما يقدر يمشي، ما يقدر يتحرك، هلكان. طبعا هاي signs and symptoms will progress gradually. That's why we are dividing the liver failure into acute and chronic. Depends on the pathology that affect the disease. مثلا واحد suicidal attempt وبلع له كمية من الباراسيتول، ايش راح يطب؟ راح يطب acute liver failure. بينما واحد عنده viral infection hepatitis C، هذا gradually the disease will progress، ايش راح يعطينا؟ الى يصير cirrhosis، يصير لنا chronic liver failure. من يصير عندنا cirrhosis، إذا صار عندنا cirrhosis بالليفر، الليفر برانكايما راح تصغر، راح يصير compression وين؟ على البورتال circulation، فراح تعطينا manifestations إضافية غير الأفكشن مالت الليفر برانكايما اللي هي portal hypertension manifestations of portal hypertension. من ضمنها مثلا يصير عندنا esophageal varices varicose veins in the lower part of the esophagus. وين ماكو portosystemic anastomosis راح يصير varicose veins. باللمبر region يصير varicose veins، بالrectum يصير varicose veins، بالlower end of the esophagus varicose veins, around the umbilicus what we call caput-medusa. These are the signs of chronic liver disease. بعد من ضمن signs مال chronic liver disease patients will have muscle wasting، لأنه احنا قلنا liver is responsible for manufacturing of protein، فما عندنا بعد manufacturing of protein راح يصير muscle wasting. من features of chronic liver disease ascites أسبابها مشتركة بين أنه الليفر fail to produce protein فيصير عندنا ascites يعني استسقاء ما يجي بالبطن، بين أنه أكو عندنا portal hypertension وهون مالتين it is a cause of ascites. leg edema يصير، أكو certain charisma for the patients with chronic liver disease. Some of the hormones are degraded in the liver, for example estrogen. فإذا عندنا liver failure ايش راح يصير عندنا؟ high estrogen level in the body، بالتالي ايش راح يصير عندنا؟ gynecomastia. Some of the GIT hormones will fail to be destructed by the liver، فراح يصير عندنا peptic ulcer. فإذا patients with liver cirrhosis are liable to have peptic ulcer. واحدة من signs of liver failure هي clubbing of the finger. Clubbing is not specific for liver failure. It can happen in heart failure, pulmonary failure, liver failure. Another important sign specific to the liver, chronic liver disease is spider nevi. Spider nevi, especially in patients who are taking alcohol. تعرفون إنه alcohol is one of the toxic substances that can destruct the liver and it can lead to chronic liver disease اللي هي cirrhosis، فيسموه alcoholic liver cirrhosis. Spider nevi is very commonly found in patients who have alcoholic liver cirrhosis. أكو patients عندهم fatty liver يسموه non-alcoholic fatty liver cirrhosis. هذا يعني ما تطلع السبايدر نيفاي كلش obviously مثل ما بالكوبوليك liver cirrhosis. زين احنا قلنا الليفر is responsible for manufacturing of clotting factors. فإذا صار destruction بالليفر parenchyma there will be no more enough clotting factors in the body, so the patient is liable to bleed. Any trivial trauma to the body can cause ecchymosis. These are some of the signs and symptoms in patients who have liver insult, and as I told you, it is related to the degree of liver insult and it is related to type of liver insult. مرات مثلا احنا عندنا liver disease, for example hydatid cyst in the liver. بس ما عندنا في الليفر امبيرمنت. شوف البيشنس هيلثي والتي كل شيء ماكو، بس اكوش عنده في الماس بالليفر. So it depends on the type of the disease and the degree of infection. And here we are reaching the important point: how to investigate patients with liver disease. How to investigate them. Here we can concentrate upon this point. We should investigate the liver function. And the liver function، شنو الأشياء اللي يسويها الليفر؟ احنا الآن نتابعها. مثلا جوندس شو نسوي؟
باليروبين.
تغسل باليروبين.
بطل وكل.
الليفر يسوي لنا بروتين، شو نسوي؟ نقيس الألبومين، نقيس البروتين. زين، اكو عندنا liver enzymes are related to the parenchyma of the liver. SGOT, SGBT هذه هم نراقبها. alkaline phosphatase. alkaline phosphatase mainly بالirritation of the biliary tree ترتفع. Another mode of investigations is imaging. Imaging. Here we investigate the liver by, for example, ultrasound. Ultrasound by any space occupying lesion in the liver. نشوف الليفر parenchyma ممكن. نشوف البلياري tree inside the liver whether it is dilated or not. ممكن نسوي CT scan to the liver. ممكن نسوي MRI. CT scan طبعا إذا dynamic CT scan is better to give us a very good pictures about the liver and liver masses. ممكن نسوي PET scan إذا عندنا suspicion of metastasis inside the liver. So these we are calling them imaging modalities to investigate the liver. بعد اكو عندنا invasive techniques. يعني أنا ممكن آخذ بايوبسي من الليفر. بايوبسي إذا عندي ليجين أو إذا عندي liver parenchymal disease ممكن آخذ liver biopsy حتى أقدر أوصل للتشخيص. Another mode of investigations مثلا واحد عنده something related to the biliary tree. I can do ERCP, and I can see all the biliary tree inside the liver parenchyma. أو MRCP رنين بس أسوي للبلياري tree نسميه MRCP. Clotting factors ضمن liver function. Also they are important to evaluate the liver status and to monitor the liver function. They are very important. باقينا 10 دقائق.
أنا ما يجي.
ها؟
كم شرح أنا ما يجي السؤال. دكتور إذا تريد بعد الاسمون نقدر نسجل التلميذ.
لا ماكو مشكلة سنكمل واحنا أنا ما أريد أسوي بردن عليكم لأنه هاي المحاضرة مطلوب من حضور الامتحان الأسبوع الجاي. ما أريد أسوي بردن عليكم. دا أسوي لكم سميشن تصير بس مفهومة يجيكم سؤال بدون شوية تجاوبون عليه. فاحنا هسه حكينا على الليفر باثولوجيز investigation how to evaluate the liver. ما راح نحكي على التريتمنت لأن هاي خارج النطاق حاليا بعدين تدخل النطاق. بس راح نحكي على البلياري تري. بلياري تري قول بدران بلياري تري إذا نرجع على الأشياء اللي عددناها قبل شوية قلنا احنا ممكن congenital anomalies. congenital anomalies affecting gallbladder and biliary are very, very much more than any other organs in the body. And it has been said that only 30% of the population they have normal anatomy, and 70% of the people they have variations in the anatomy of the biliary tree. And congenital anomalies which affect the gallbladder, for example, duplicated gallbladder, bisected gallbladder, diverticulum the gallbladder, intrahepatic gallbladder, left-sided gallbladder, a lot of double cystic gallbladder. Biliary tree also can be affected by congenital anomalies, for example, atresia, the failure of canalization, or atresia of types. Circulation, choroidal cyst, divertically, biliary tree can be seen. But a lot of congenital anomalies, the most common gallbladder هي Phrygian cap. بعدين إن شاء الله صف رابع تنال عليكم محاضرات gallbladder and biliary tree تاخذوها بالديتيلز. بعد inflammatory processes مثل ما حددنا قبل شوية which affect gallbladder, cholecystitis أو biliary tree نسميها cholangitis. أكو عندنا primary sclerosing cholangitis، أكو عندنا secondary sclerosing cholangitis. واحدة من most fatal diseases هي sclerotic cholangitis and mandatory liver transplant. Infection, almost always ascending from the bowel, most commonly E. coli, can cause suppurative cholangitis and it can cause cholecystitis. Here there is something peculiar to the gallbladder and biliary tree. It can be affected by stones. مثل الليفر ما بيه هاي الخاصية، لأن يبين هاي الخاصية، وين ماكو مكان بيه fluid بالبودي it can be affected by stones. اكو فد certain metabolic drive constituents مالت البايل تتغير بحيث يصير lethogenic bile تبدي تتكون عندنا stones. And one of the most common condition you will see in surgery هو gallstone. Gallstone, different types. نسميها cholelithiasis. Stones can affect also the biliary tree, and it is called choroidocholithiasis. Tumors can affect biliary tree, نسميها cholangiocarcinoma, or can affect the gallbladder. Gallbladder is either affected by benign tumor or malignant one. Benign tumor عندنا البوليب، واحدة من benign tumors that affect the gallbladder، وعندنا carcinoma mostly adenocarcinoma, but sometimes it is metaplastic carcinoma, squamous cell carcinoma. Trauma is another insult to the biliary tree. Patients, for example, stab wound or road traffic accident can have biliary tree or gallbladder injury. طبعا هاي كلها بيها ديتيلز وما راح نحكيها الديتيلز مالتها نرجع على نفس البوليسي مالتنا اللي حكينا بيها على الليفر. Here also how we discover the disease that affect the gallbladder and biliary tree. نرجع عندنا signs and symptoms and investigations. أنا أعطيكم المحاضرة بهاي الطريقة حتى يعني تكونون قادرين على الإجابة لأي سؤال تعرضون له. أوكي؟ يعني كل مكان تقريبا من اللي حكينا عنه other places in the body, you have the same vision to approach the patient. You know about the anatomy and physiology of this organ, and you know what are the diseases that affect this organ, and then you are able to diagnose the patient by his signs, symptoms, and investigations. Of course, there are special investigations for each disease. So, the signs and symptoms of patients with gallbladder and biliary disease differs according to these insults. يعني اللي جاينا عنده congenital anomaly, for example infant أو neonate, وعنده biliary atresia, مباشرة راح يصير بي obstruction, يصير بي jaundice, يصير بي cholangitis, ممكن يدخل إلى liver failure. مو اللي جايني عنده cholangitis راح يصير عنده pain. اللي جايني عنده tumor مالت الجولبلدر او biliary tree راح يصير عنده jaundice، عمره راح يختلف، الريسك فاكتور يختلف، وهكذا. What are the investigations important for gallbladder and biliary tree? Here also we can measure
bilirubin.
Very good. We can measure bilirubin and see what is happening, and we can use imaging as in case of the liver. Imaging تشمل هنا the least invasive هو الالتراساوند. The most invasive هو ERC أو surgical exploration. بعدين هنا نفس الشيء نجي على الفانكشن، نفس الالكلاين فوسفيت، البيليروبين، نجي على الايمجنج نستخدم الالتراساوند، نستخدم السي تي، نستخدم الام ار اي. هنا سبيشالي بالجولبلدر biliary tree نستخدم ام ار سي بي. Special MRI for biliary tree and gallbladder. Sometimes we use isotope scan. We call it HIDA test or BIBDA test. These are tests which test the function of the gallbladder.
بس باختصار عن الام ار سي بي.
Magnetic resonance for the cholangiopancreatic neuron, for the biliary tree of the and pancreatic duct. The same as MRI, but for the cholangiogram and pancreatogram.
يعني صباط.
لا ما هذا رنين. رنين مغناطيسي.
يعني مو كل الجسم فقط.
الرنين يعني الميكانيزم مالته الاكشن مالته هو يعتمد على الهيدروجين كونتنت بالضبط، فهو يطلع لك الصوره حسب الووتر كونتنت او tissue or fluid. And as I told you, ERCB this endoscopic retrograde cholangiopancreatogram here is invasive. So when we use invasive technique, it is better to do it for not only diagnosis, وإنما for therapeutic purposes, to treat the patient. Through the endoscope we can enter the ampulla of water مثل ما شرحناها بالاناتومي. We can inject dye to visualize the whole biliary tree, even the pancreatic duct can be visualized. وراح نشوف راح نعرف وين مثلا اكو obstructive elements For example عندنا stone we can retrieve it نطلعها. اكو عندنا different mechanisms بالون دورميا باسكت عندنا different mechanisms او اذا كريبسي تسوي ممكن you destruct the stone so it is used for diagnosis and treatment. KRCB made. Of course the treatment depends on the pathology. For example patients with biliary atresia حسب التايب مالته. اكو عنده extra hepatic biliary dilatation ممكن نسوي anastomosis. ما اكو عنده ممكن نسوي بورتو انتروستومي او كاساي اوبريشن نسميه. patients صار cirrhosis ممكن نسوي له liver transplant. Now another example patient عنده gallstone شو نسوي له cholecystectomy you remove the gallbladder. نجي نحكي على البنكرياس لاست خلال دقيقتين ثلاثة.
انت وراحتك حتى الان هو الدكتور ما
لو تعبت
لا انت راح تقدر تسوي محاضرة لطيفة. دكتور انت تسأل انه كل المعلومات اللي بالمحاضرة مطلوبة؟
احنا ايش قلنا بداية الامر؟ قلنا هذه القضية ما تحل بساعة.
صحيح.
يعني احنا عندنا اكو قابلية بأنه هذا الموضوع ندخل بيه بعد ما نطلع بيه. الآن توصل إلى سب سبيشاليتي، يعني تخلص الطبية وتروح تاخذ بورد، والطب سب سبيشاليتي تاخذ بورد ثاني بالليفر. مش كم سنة؟
شنو يطعينه بدون تعيين؟
زين. وحتى تاخذ سب سبيشاليتي وبعدك ما مخلص التلف. فالموضوع يعني endless ما بي نهاية. بس احنا we are highlighting some points upon these organs and the pathology affecting them, the way of investigating them, and some points about the treatments.
يعني نقدر نقول دكتور 80% هو المطلوب بس احنا حكينا.
اللي حكيناه بالمحاضرة هو المطلوب الرئيسي بالامتحان، وهم مطلوب رئيسي منكم كاستيعاب الموضوع. انتم تقرون هنا، بس انا مثلا اذا واحد هو انترستد هو gifted person ويريد يقرا على البنكرياس ويقرا على الكرونيك بنكرياتايتس والاكيوت بنكرياتايتس وهاو تو انفستيجيت، هذا يعني هو عنده انترست شيء، هذا مفتوح المجال. بس اذا لحد مرحلته شو المطلوب من عنده؟ مطلوب من عنده اللي حكيناه هسه بالمحاضره. ما اطلب من عندك بانه هسه تصير هيباتولوجيست. لا هذا جريمه بحقك، مو؟ ولا اطلب من عندك هسه انت تستوعب الاميبياسيس كلها والهايدروتوسيس كلها وانواع الهايداتسيس وانواع الاوبشنز مالت التريتمنت اوف هايداتسيس ان ذا ليفر. هذا مو انصاف. بس انا اريد من عندك تعرف بانه الليفر can be infected by viruses, by parasites, by autoimmune diseases, by ايش يعني؟ هاي معلومات يعني عامة تاخذها وتستفاد منها ان شاء الله بالامتحان. راح تنسألون اسئلة بالضبط مثل ما احنا نحكي بالمحاضرة. فالبنكرياس the same policy بانه can be affected by congenital anomalies مثلا pancreatic divism as an example, or by inflammatory processes pancreatitis يصير عندنا مثلا اكو مثل الاوتوميون pancreatitis او idiopathic pancreatitis او اكو metabolic causes for pancreatitis, for example hypercalcemia. اكو الانفكشن هم نسوي لنا ascending infection بالبنكرياس سوي لنا pancreatitis. اكو الفيرال انفكشن مثلا كوكساكي بي فيروس سوي لنا pancreatitis. now COVID-19 one of the causes of pancreatitis. واحد من COVID-19 يصير عندهم pancreatitis. mumps virus. mumps نكاف. سامعين بي؟ واحدة من الكومبليكيشن مالته mumps هو affect salivary glands. one of the complications يسمونه orchitis أو بالفيميل أو pharyngitis, and it can cause also pancreatitis. مثل ما حكينا قبل شوية قلنا اكو عندنا inflammatory واكو infection واكو tumor. tumor can affect the pancreas, can affect the tail, the body, the head. اكو خصوصية إذا affecting the head ما قلنا اكو عندنا duct of Wilson تتحد ويا من welcome bile duct. فممكن انه الهيد او البنكرياس هذا الكلام خلصنا. ممكن the tumor of the head of the pancreas can cause obstruction to the CBD, and patients with a tumor of the head of the pancreas يجي the presentation مالته jaundice. pancreatitis فيها سكولي, ممكن يصير عندنا pseudocyst of the pancreas. اوكي, والسيدوسيس إلها its own complications, ممكن يصير فيه infection وابسس وسبسس ورابتشر وايروجن للفيزلز ويصير bleeding inside it, ممكن ايروجن للفيزرا, ممكن ايروجن يطق بالبريتونيوم يسوي لنا بريتونايتس. بس احنا اللي نستفاد من عنده بانه احنا the same policy can be applied for all the organs. فاذا الافكشن of the pancreas نقدر نبوبه مثل ما بوبنا الافكشن of the liver وافكشن of the gallbladder biliary, and can be applied here. How to investigate patients with pancreatic disease? The same policy. اكو عندنا function of the pancreas
كمل دكتور كمل.
واكو عندنا الايمجينج. How to assess the function؟ حكينا قبل شوية. اكو عندنا اكسوكرين واكو عندنا اندوكرين part of the gland. الاندوكرين part of the gland معناها هنا اذا صار دمج بالبيتا سيلز ايش راح يصير فينا؟
بالتصل عميد تجي سوري.
ايه ايش راح يصير لنا؟ دايابيتس. ايش راح نقيس؟ لا نقيس بلاد شوجر. بلاد شوجر راح ونقدر نقيس الليفل اوف انسولين ايضا. زين. هذا this is one example. ممكن اذا واحد عنده بنكرياتاس نقيس به الانزيمز. ممكن نقيس الاميليز، اللايبيز. الايمجينج هنا هم the same policy. عندنا الترا ساوند نون انفيزيف نقدر نشيك بيه البنكرياس. بس هنا البنكرياس اكو قدامها ستومك وقدامها كولون. الالترا ساوند له حدوده. من اكو غاز قدامه ما يقدر يشوف زين. ما تنتقل الامواج الصوتيه بالهواء مو مثل ما بالماء وبالتشو تنتقل مو. بس اذا واجهت لها فشي صار شو يصير بيها؟ ترتد، يصير بها ريفلكشن.
يعني دكتور احسن شيء يعني احسن فحص شو نسوي؟
يعني شوف حتى تعتمد على البادي بيلدز. ممكن واحد ثين بيشنت نستخدم الالترا ساوند ونشوف ديتيلز اوف بنكرياس. بس اذا فاتي سي تي هو in all the cases is valuable. In all the cases CT scan is valuable. حتى بالسي تي تقدر تشوف ديتيلز اوف البنكرياس. زين. مرات انت تصعب عليك حتى بالسي تي ما تقدر تحكم ايش تستخدم؟ ERCB ممكن تستخدمها حتى توصل للدايجنوز. مرات تستخدم what we call EUS اندوسكوب. تدخل بالاندوسكوب تبث الترا ساوند ويفز حتى تشوف البرانكايما مالت البنكرياس. وممكن ويا الEUS يسوي تدخل لك نيدل وتسحب تشو حتى تسوي بايوبسي وتشوف find needle aspiration تشوف cytology of the pancreas, تشوف what is affecting the pancreas. And lastly, the treatment depends on the pathology affecting the pancreas. والسلام عليكم ورحمة الله وبركاته.
دكتور شنو أسئلة يمكن معاكم لو
أسئلة
دكتور لو يحتاج
تريدون تسألوا ما في مشكلة.
طلاب
هسه أنا يعني متأكد بأن الطلاب راح يقولون المطلوب المحاضرة ولا السلايدات؟
لو شرح ما
دكتور هم سمعوا السؤال وانا فايش الدكتور.
لا هو دكتور هم سألوا واحنا لذلك سألنا. كانت بعد جاوبتنا.
أنا أعيد لكم الجواب بأنه up to your level المطلوب المحاضرة.
دكتور
أما ليش إحنا حطينا هاي الباوربوينت وحطينا الديتيلز حطينا
في
اسمها؟
فائدة.
هاي اللي عنده يعني توجه على هذا النظام الجديد وعنده وقت فراغ
يعني
مكان ما يلعب جيمز شو يسوي؟ يدخل.
على السكات.
أنت سميه سكاش أنا نسميه عبقري هذا.
دكتور الاندوسكوب مال الالتراساوند يوصل لنا للدودينال مفصل
يوصل للدودينام ممكن يوصل حتى للدودينام بس احنا من نريد نفحص بالبنكرياس دائما نفحص بالهيد اوف ذا بنكرياس. It is very difficult to see the tail of the pancreas.
يعني
الهيد in intimate contact with the duodenum واحنا داخلين
الدودينال بس
التيل لا التيل رايح وين بعيد. طب بالجو اللي